today. Thursdays, as you know, time we set aside to talk with members of our medical community. Joining us today, Dr. Robert Boswell, a orthopedic surgeon, talking about the rotator cuff injuries. And because of my background in broadcast, I've done sports here for so many years. As soon as I hear rotator cuff, I think of pitcher.
Absolutely.
I think these kind of things. But is that the predominance of this injury? Is it athletic related?
Not often. What we typically see is it's an overuse, typically in the 40 or older crowd. And that's what the majority of my patient population is the over 40 crowd, who typically overdo something, maybe over a weekend. Moving is a big mechanism of injury, or painting a house, painting a room, something along those lines.
So we can really come on that sudden. Now, see, I thought this was, years of abuse, but it can come on that sudden.
It can flare up like that. We definitely believe that it is an over time wear and tear process, that over time your shoulder and your rotator cuff tends to wear out. And then it becomes more susceptible to injury as we get older. So
if you're one of the guys in your 40s like myself, or ladies out there, and you do an activity over the weekend, and you feel, how severe is this going to feel that I would think, I need to really come in and see what's going on?
Well, I think initially you're going to have that pain. It's going to catch your attention. And so you're going to shut things down. You're going to give it some rest, maybe take some ibuprofen. But if it persists for 2 or 3 weeks and it's not getting any better, maybe that's when you should talk to your doctor.
And when that talk begins, what are we looking at? How do we kind of clean this thing up?
Well, we always start conservatively with anti-inflammatory medicines and physical therapy and rest. If that doesn't work, we institute things like cortisone injections. If that doesn't work, we move forward, get an MRI, and look to see if there's anything damaged.
So surgery is always the last option?
Last resort, and typically indicated when there's an injury such as a rotator cuff tear.
Okay. And if it gets to that point where you've got to go in, open someone up, clean up the damage, is this a lengthy rehab to get someone back to where they can go out and maybe throw the tennis ball up and unleash the fury on the tennis court?
Well, the surgery is minimally invasive. We do it arthroscopically, but yes, the recovery process is long. It does take a number of months for most people to get back into the swing of things, especially throwing and stuff like that.
Yeah, because I know, again, when you think of a pitcher and you hear rotator cuff surgery, usually they're shut down.
Season-ending injury.
But it's not definitely life-changing injury.
No, I think it's something that we can manage and get people feeling a whole lot better.
And why do you think it's 40s and older?
Just wear and tear.
Okay.
Our tendons tend to deteriorate a little bit as we get a little older.
Youngsters out there.
I know. So enjoy it while you're young.
God, it's so good. Again, if you have a question or concern, I always say don't call me because I don't have a white coat. I got a blue coat. I don't have the degree. We can get you in touch with a medical physician and they can kind of help you on your way. Doctor, I appreciate the time.
My pleasure.
Thank you for the knowledge. Gannon?
Okay.